Until now, there has been no non-invasive treatment for the underlying cause of painful circulatory problems. But a patented and FDA-cleared device called Anodyne therapy is bringing hope to millions of sufferers. Anodyne therapy emits monochromatic infrared energy at a wavelength of 890 nanometers from 60 superluminous diodes from each therapy pad. While infrared light at this wavelength is not visible to the human eye, it penetrates 3 to 5 centimeters into body tissue and through a biological cascade causes the liberation of a compound called nitric oxide from hemoglobin in the blood. This release of nitric oxide causes vasodilation of local blood vessels, which indirectly relieves pain caused by lack of blood flow. Dr. Lawrence Harkless, former professor at the University of Texas at San Antonio, is an expert in the diabetic foot and currently serves as the founding dean for Western University of Health Sciences College of Podiatric Medicine. Over 20 million people suffer from pain due to circulatory problems, and the causes are many.
Clearly the most common cause is diabetes, and we see that very, very commonly here in our institution.
In addition to diabetes, lower extremity circulatory pain can also be caused by alcohol abuse, peripheral vascular disease, certain drugs like statins, chemotherapy, trauma, and autoimmune conditions like HIV/AIDS, and the effects on quality of life can be debilitating. So what about the current treatments? Good blood sugar control is always the first course of action for those people with diabetes, and there are some other pain medications that can be used, like antidepressants and anti-seizure medications. While medications may help with the pain, there has been no treatment to deal with the underlying cause of the pain, which in most cases is a direct result of reduced microcirculation. In addition to age, various conditions such as diabetes, high cholesterol, and atherosclerosis contribute to constriction and impairment of the local circulatory system. And that is exactly what Anodyne therapy is designed to do: increase blood flow. A sophisticated device called a scanning laser Doppler can be used to measure changes in circulation. The following images of the heel, sacral area, and knee show increases in circulation up to 3,200%. These images show a comparison in circulation changes between anodyne therapy treatments and a conventional heating pad. As you can see, even 4 hours after anodyne treatments were ceased, local blood flow was still elevated at 164%. But the proof is in clinical practice. There are now over 5,800 hospitals, therapy clinics, nursing homes, home health agencies, and U.S. military hospitals using anodyne therapy routinely as part of their comprehensive therapy programs for patients with painful circulatory conditions. Life Care Center of Charleston is one such facility.
In this facility, we have had excellent response to Anodyne. Out of 275 patients, we've maybe had 3 that didn't respond at all. Most patients will report decreased pain, most no pain at all by the time they leave our outpatient therapy program. And functionally, people are doing much, much better.
We had one patient who basically fell every day. To imagine doing that every single day, it's hard. We've had people come in with walkers or canes, and they have stopped using them. Their balance improved so much.
As a physical therapist, before there wasn't much we could do to decrease pain. We've treated well over 100 patients. We've seen wonderful results. We've seen patients who had unbearable pain that would be listed at, say, a level of 8 out of 10 be reduced to 0 out of 10 in 3 treatments. It's offered up the opportunity to change the quality of life of our patients, to actually go in and have an effect on someone's pain level. All of that offers up a feeling of empowerment, not only for our patients, but for our therapists and for our physicians.
It's clearly a non-invasive device that really has no side effects, and the fact that it improves blood flow. So those are all significant positives for this particular treatment modality, compared to drugs and other modalities that have been utilized in the past.
When you hear about Anodyne, you think it's too good to be true. It's not. It really does work.
Anodyne offers up hope for our patients, for patients that previously felt like there wasn't an alternative for them.
How do the patients feel about their results?
I started to feel things like a breeze on my legs and things like that I hadn't felt in years. I was able to sleep better at night, backed off all the pain, a lot of the pain medication, and quality of life started to change. It really did. I was able to start walking again. It was almost miraculous.
It wasn't but about 3 treatments that I could tell a big difference. And before I got through with the Anodyne treatment, I bought a pair of shoes, closed in. That was the greatest feeling I ever had. The greatest thing in the world is to be able to go to bed and go to sleep. People that's never had it, they don't know how bad it is.
Chronic pain doesn't have to be disabling. Every day, thousands of people with chronic pain due to circulatory problems being treated at Anodyne therapy providers worldwide are learning they can get back to life with less pain and more confidence in their ability to walk, drive, and exercise. And that certainly makes life a whole lot more worth living.